Hi, I'm Dr. Maria Atkins, Medical Director here at the Cosmetic Enhancement Center of New England, and I'd like to welcome you to our follow-up skin lifting and tightening virtual event featuring Sofwave technology. Tonight, we share how Sofwave works, what makes it unique, and the incredible results our patients are seeing. Be sure to stay tuned to the end for our live question and answer session, where you'll be able to submit questions in the chat and I will answer them live. And don't forget, we have a raffle for a free Sofwave treatment tonight. And then 20% off will be available to all attendees until March 31st. Sofwave is an advanced ultrasound treatment designed to lift and tighten the skin in a completely non-invasive way. It delivers energy into the deep dermis, which stimulates your body's natural production of collagen and elastin that keeps skin smooth and youthful. Over time, you'll notice a gradual improvement in tone, texture, and tightness. The beauty of Sofwave is that it works with your own body's natural healing process to create natural-looking results. There are many devices out there that claim to lift and tighten skin, but Sofwave truly stands apart. Sofwave's parallel beam technology is unique because it delivers energy precisely at the right depth where the collagen and the elastin are formed, without damaging the surface of the skin. That means patients experience no downtime and achieve noticeable results. Sofwave is ideal for treating fine lines, wrinkles, and skin laxity, especially in areas like the face, jawline, and neck. Many patients come to us because they want a refreshed look without surgery, and Sofwave provides exactly that. It's also a great option for those who are starting to notice early signs of aging and want to be proactive. One of the biggest advantages of Sofwave is the minimal downtime. Most patients can return to work, social activities, and even the gym immediately after treatment. And side effects are typically limited to a mild redness that fades very quickly within 10 minutes. Results begin to appear within a few weeks, collagen production increases, and the most dramatic improvement is seen around 3 to 4 months after treatment. This is a before and after on a patient who just did around the mouth, and you can see that on the left she has more pigmentation, more redness, more wrinkles, deeper lines. On the right, the lines are softer. It's not quite as deep. She's got some lifting in the corners of her mouth. Even the lips look fuller because the lip is lifted. If I go to the next one here, this was somebody who did her full face, but only wanted to show a portion of her face when we asked for consent. Now you can see that under the eyes and in the cheek, she can definitely use a little bit of volume in the cheek, but she has much less wrinkling and lifting in the skin after one treatment. This is the other side for that same patient. Again, a lot less lines under the eyes, a lot less crepiness and wrinkling around the cheeks and under eye area. This is also somebody who did just under eyes, and she had a lift in the lower lid so that it's not actually drooping, and some smoothing of the wrinkles around the eye, and this is her other side. Again, lifted, smoother, less wrinkling, and even the puffiness under her eye looks better. This is a neck treatment. Again, one treatment of the neck with just the Sofwave, and things are not 100% better, but they are definitely smoother and lifted, and that's a typical result. You're not going to get everything go away with any non-invasive procedure, but improving the quality of the skin and stimulating collagen you should see with each treatment. This is lower face treatment, and if I show you along the mouth and jawline, you can see its lines aren't gone, but they're definitely less dropped and they're more lifted. If you look at the other side, same thing, smoother, less dropped, more lifted. If we go on to another perioral treatment, this was just one treatment, and you'll see that the lines are not quite as deep, and a treatment like this may only take a few hundred pulses and only be $600 or $700 for a treatment if all you're doing is the mouth area. This is actually me under chin area, and right after the treatment I had improvement, and all I treated was under the chin. Just that area right there, you can see is much better right after the treatment. Same face forward facing, you can see it's a lot better, more lifted, smoother right after the treatment. Thank you all so much for joining us tonight. Remember, giveaway winners will be notified by text or phone call. Most importantly, check your text messages after this event. Reply back to book your consultation or appointment, and our team will reach out to schedule you. I'll be here for the next 15 to 20 minutes to answer your questions live in the chat. We look forward to helping you discover how Sofwave can lift, tighten, and refresh your skin. Hi everyone, welcome tonight. I appreciate you coming to our event. This is our second Sofwave event. I know we've done several virtual events, but this is our second Sofwave one. And I see we had a ton of people sign up, so I appreciate you coming. Just so for those of you who are new to me, I know that I see a lot of names on here that I already know, but if you're new to me, I am Dr. Maria Atkins from the Cosmetic Enhancement Center of New England. I'm the medical director there, and I have been for 30 years plus now. And we have been doing Sofwave treatments for a couple of years now. It's been around for, I think, more than 3 years now, but we've had it for about 2 years. And we've done so many Sofwave treatments in the last few years. Our practice is #1 in the New England area. That includes Maine, New Hampshire, Vermont, Massachusetts, and Connecticut. We are the #1 practice for Sofwave in the number of treatments that we've done. And we are 9th in the US for Sofwave practices that have one device. So we are pretty well experienced in the treatment, and I am excited to answer some questions. Just a reminder also that we do have a 20% off available to everyone who has attended tonight. And so if you book a treatment before the end of March, you'll get 20% off of that treatment. We are also, by the end of the event, going to, actually not by the end of the event, but we are going to raffle off a free treatment for Sofwave for somebody who attends to the end of the event, basically. So definitely stay tuned and listen to some of everyone else's questions as well, even if you don't have your own. So let me get started with some of these questions. We have a lot of them coming in. It looks like, what is the range or estimated cost for under the chin? So that's a great question. The cost for treatment with Sofwave is based on the number of pulses that you do. We charge by the number of pulses. Most practices don't, but we do. It is $5 a pulse plus $135 for the visit. Now, each area that you treat is going to need so many pulses to get the right amount of result. So the protocol for Sofwave has changed over the years, and it's called treat to total energy, basically. And we grid this face in 2x2 grids, 2 inch by 2 inch squares, and we need to deliver enough energy into that square to treat that area. So, for instance, the under chin area, that's what I had treated in my before and after video. I did, I believe it was three squares of treatment, one in the middle and one on each side. And it was around 90 pulses. So, each square of treatment, that 2x2 square, takes anywhere from 30 to 35 pulses, and we would basically say, okay, what area do you want to treat? We can grid the area and give you an approximate cost. Now, how many pulses does it take to treat that small section of your skin? Generally 30 to 35 pulses, because it depends on how much energy we use. I tell people that you do not need to suffer during this treatment. Yes, it can hurt, but you don't have to hit the highest energy in order to treat it. For instance, when I did this treatment, I was at really the lowest that most people do, right around 3.2, and it just took me a few extra pulses to get through that square. So as we're delivering the energy, the machine will tell us when we've delivered enough energy. It usually ranges around 30 to 35 pulses, and then we're done with that spot, and then we move on to another spot. So the pricing depends on how much area you want to cover. The mouth area might be around $700. The under chin, if you're just focusing right underneath, might be around that same amount. If you're going to do a full lower face and neck, you're probably looking more like $3,000 if you're talking from the cheekbones down to the collarbone. It basically just depends on how much area you want to cover. So definitely, if you'd like to come in for a free consultation, we do free consults all the time. Somebody can map out the face and see the areas that you're most interested in and tell you a more accurate price range for you. Another question here, is it as painful as all therapy? So if you know our practice, we have also all therapy in our practice, and for some people we do use both, but for the most part we start with Sofwave because it delivers more energy to the skin in less pulses. So in that respect, it's less pulses, so it's less painful because of that, and it doesn't have those zinger type pains that you can get with the all therapy. It is hot, but we can again mitigate that pain by adjusting the energy level for you. I have people who sit up off the table, do the highest energy, and they're like, yeah, that was nothing. And I have others like me who struggle with the higher energies, and I needed to stick with lower energies. I'm sensitive to heat, and it bothered me more than some people. So I did smaller area. I just did a small area, and then I can go back and do another part of my face at another time. So you don't have to do the whole face at one time. It's not like a microneedling treatment where you want to use those needles and get the whole treatment done at once, because the disposables with an ultrasound device, which is what the Sofwave is, there's just some ultrasound jelly that we wipe off and clean off when you're done. There's no downtime. Your skin looks completely normal afterwards, maybe a little red, and a lot of people like me will sit off the table and see the improvement right away. Other questions? What is the efficacy compared to all therapy? So I think that it really depends on the person. We will add all therapy pulses to somebody who has a very heavy jawline and a heavy neck. And that is because of the thickness of the skin. All therapy does have a transducer that goes deeper in the skin than the Sofwave does, but for most people, you usually do fine with just the Sofwave.
how much time does it take and how long until results are seen? So like I said, you can see results sometimes right away when you sit up off the table. I hear the comments very often that people see it right away, but you'll see improvement at a month's time and even more improvement over 3 to 4 months. The amount of time it takes to do the treatment will depend on how much area you decide to do. When I did my chin, it took maybe 15 to 20 minutes. If you're going to do the full neck, it's probably going to take more like 40 minutes or 45 minutes. If you're going to do the full lower face and neck, you might be an hour and a half. So it definitely depends on how much area you're willing to treat at one visit. Let's see here. Is Sofwave done immediately under the eye area, or is it a different treatment used for that? So we do Sofwave immediately under the eye. It is limited in that the handpiece is bigger than some devices. So for instance, a CO2 laser, I can get right up to the lash line with the CO2 laser. You can't do that with Sofwave. So with the Sofwave, we do treat right in that area, but it doesn't always treat right up to the lash line. What else here do we have? There's lots of questions. How long do the results last, and how many do you have to do to fully address an area? So one treatment should give you some improvement. That's what the standard protocol is, just one treatment. But I always tell people, some people are, this is not a facelift. You're not going to get facelift results out of a non-invasive treatment, but you will have an improvement in one treatment. And can you do another one? Sure, absolutely. I generally recommend the same area. You don't treat for at least a month, and you can do a second treatment and get more improvement, absolutely. But you do have to repeat it every year. It is not something that's going to halt time for you. You continue to age, you continue to get saggy over time, and you're going to need more treatment. This is not going to make it snatched and tight forever. So even facelifts don't do that, but they can last a good 10 years. A good facelift. With non-invasive procedures, we recommend at least a treatment a year to keep the skin, keep your skin producing collagen and stimulated and getting that firmness back, basically. What else do we have? I have a lot of sagging in my lower face, like the jowls. Is it too late because it's not preventative? No, it's not too late. As long as you have realistic expectations and aren't expecting a facelift result, then you will see improvement. The question will be, is that all that we should do for you? That's where our free consults come in, because some people need a little bit more than just some tightening. Sometimes you need some volume. If you have hollowing in the cheeks, that hollowing flattens the cheeks and drops the skin down to the jowls, you're going to need a little volumization in the skin to help lift. It's definitely important to have an assessment and have somebody help you figure out whether or not a Sofwave is all you should be doing. Sometimes there's other things that you should consider as well. I find that the people who are the happiest are the people who do a little bit of this and a little bit of that and don't say, I'm going to come in, spend my $5,000 and then I'm done. No, that's not the way to do this. You have to think about these things as maintenance. You need to maintain your car, you need to maintain your body, you need to maintain your health. And if you want your skin to be maintained, then doing these things regularly, and you can pick and choose what things work for you or what's going to be the treatments that are best suited for you. But people who do a little bit of this and a little bit of that are really going to be the happiest and show the most long-term improvement. How does this compare to the CO2 laser treatment? So the CO2 laser is basically fresh new skin and has a full week of downtime afterwards. I love the CO2. I saw the most amazing before and afters today with CO2. It does so well at textural lines and fresh new skin. It helps with pigmentation and gives that healthy glow back to the skin. Your skin looks really dull as you age, and that just takes that dead cell layer off and gives you a fresh new new skin. That is more superficial than what you're going to get with the Sofwave. The Sofwave is not on the surface. And remember, Sofwave has no downtime. Are they mutually exclusive? No, absolutely not. I've done CO2. I did it last March, and I just did another Sofwave recently. So you are going to get more lifting with no downtime with the Sofwave, and you're going to get more textural improvement and pigment improvement and fresh new skin with the CO2. And again, we do free consults. So if you want help deciding, come on in and we'll take a look at your skin and help you decide. How often can you receive a Sofwave treatment? Again, I think that you need to do it at least once a year. Some people put themselves on a 6-month schedule because they just want more improvement, which is completely fine. You can do a second treatment within a month, but you're not going to do it monthly. You might do 2 treatments a month apart and then maybe do once every 6 months or once a year from there. Were your results just after 1 session? Yes, my results were after 1 session, immediately after. Was that I respond really well to Sofwave, but I also respond to really well when I did therapies as well. My therapy results, however, were much slower than my Sofwave results. Back when we got therapy in 2015, I think I didn't see my results until about 9 months afterwards. We kept taking photos. It took a while, but it did. It helped, and it happened. It tightened. With the Sofwave, I see results immediately. And I see that frequently. People see that. Not everybody's that way, so don't go in expecting it. Not everybody sees it right off the bat, but I took those photos immediately after. And did it soften a little bit and not show completely that same result? Yes, but it is still much better. And I had the same kind of improvement the last year when I did it. I had immediate results, and then over time you age, you get saggy again, and you need more treatment. Does it help with ptosis? I've been contemplating a blepharoplasty, but would this help lid drooping? All right, so we can treat the eyes and the forehead. When we treat the forehead, we can get a little bit into the brow and under the eyebrow, and you can treat the whole forehead. And you treat the whole forehead, you'll get lifting in your forehead. You treat right in the middle of the eyebrows here, but you can't treat over the eyeball. So if your lid laxity is because the lid itself is sagging, you can see actually in my eyes, I have one lid that sags more than the other. And doing the Sofwave helped lift the lid up here, but it's not going to help lift this part of the lid. That is something that even after a blepharoplasty may not improve. So it depends on what you're looking at for improvement. If you're looking at getting this skin better, then yes, it's going to help. It's going to, lift that skin, especially if you do all the way up into the forehead. But if you are talking about a true ptosis where the eye doesn't open as wide on that side, that's hereditary, and that will not go away. Okay, let's see sorry, I'm trying to scroll here. Here we go. Scroll to get some more new questions. As far as lifting the jowls and neck area, which one is better? So I'm assuming you're asking which treatment is better, but I'm also wondering if that's CO2 or Sofwave or therapy or Sofwave. I'm not sure because there's been a lot of questions about both. When it comes to CO2, it's going to be textural. You are going to get some lifting, but I don't tell people to do CO2 expecting the lift that you'll get with Sofwave. CO2 is more textural improvement, although you will see some lifting too. It's just not as much as Sofwave. If you're talking therapy versus Sofwave, the reason we made the choice to go with Sofwave in the first place, because we already have therapy, was because the amount of energy delivered into the skin at those superficial layers, right at the dermis, where collagen and elastin are produced, is much greater than Ultherapy. So Ultherapy has 3 different level transducers. There's a 1.5 millimeter, a 3 millimeter, and a 4.5 millimeter. So it goes all through the depths of the layers of the skin, whereas the Sofwave is just 1.5 millimeters. But that 1.5 millimeter pulse is a much longer pulse and delivering much higher energy. And so you're getting a lot more tightening in that layer. And that is the layer that is right at the dermis where the elastin and collagen is produced. So you might get more depth with Ultherapy and tightening, but not as much energy. But if you need that depth, then combining the two is possible. You would just do some deeper pulses with the Ultherapy and still do the Sofwave superficial pulses. With pretty much eliminated the superficial pulses with the Ultherapy because the Sofwave is that superficial level and gives much more energy for those pulses. What side effects are there? There really aren't any. I've seen some people have maybe a little patch of redness on one spot where they maybe turn their head when the pulse was being delivered, but generally it's nothing. You look maybe red for about 10 minutes afterwards, and that's a maybe. Most people don't even look red afterwards. It just depends. Some people are a little more sensitive to being red after a treatment, but it definitely doesn't last for longer than 10 minutes. Can Sofwave be done at the same time as filler? So you can do it on the same visit. I always recommend the Sofwave first and the filler after. And the reasoning for that is anytime you have any Botox or filler, you do not want to heat up the area, which Sofwave would do, for at least a month. Okay, so rule of thumb, any Botox or filler done, you want to wait 1 month for any heated device, including Sofwave or CO2. Between RF, Virtue, and Sofwave. Okay, so Virtue RF is a microneedling radiofrequency device that delivers radiofrequency heat down into the dermal area of the skin, same area as Sofwave. The difference is that the Sofwave will deliver more energy, so more lifting, but the Virtue is going to have those needles kind of penetrating the skin, so you're getting more textural tightening. Also the difference, because the Virtue is needles, you're actually going to want to treat a larger area at one time. So you're going to want to do, the full face or the full neck and chest or all of that at once, because your cost is a lot dependent on the fact that we have to dispose of those needles when you're done. So most people want to do it all at once, whereas the Sofwave, you can come in, get a little bit here, come back in a week, do a little bit here, come back in another week and do a little bit here, so that you can spread it out, 1 for cost, 2 for discomfort if it's uncomfortable for you. We also have Pronox. Remember, that's the laughing gas that we use if people are a little concerned about discomfort. And if you're really concerned, I just schedule a small treatment. Do a little bit in one area at the most, the area that bothers you the most, and that way you kind of get a feel for it and whether or not you're somebody who tolerates it amazingly and doesn't need anything. If you need a pain medicine, I can call in a pain medicine, so that's an option as well. Is there an age limit on treatment? Nope, I do not put age limits on treatments, regardless of whether it's Botox, fillers, laser treatments, or energy devices. Just because we're older doesn't mean we don't care, and that doesn't mean you're not going to respond either. I said earlier today, I saw somebody who had amazing results from a CO2 laser, and she was definitely elderly. So you can do any of these devices and still see improvement. It's about realistic expectations. You're not going to look 40 after doing a Sofwave treatment if you're 80, but does that mean that you can't do it and I won't see results? No, you'll still see some improvement. Some of the pictures that we showed in the video were older, so you definitely can still do that. Are there any special considerations for pigmented skin with the Sofwave? Not necessary with Sofwave. Definitely we have to worry about darker skin types with some energy-based devices, because anytime darker skin tones have inflammation in the skin, they can respond by producing more pigmentation and having pigmentary issues afterwards. But that's not the case with Sofwave. Sofwave is very safe, and again, goes down below the surface of the skin, so you're not hitting the pigment on the surface at all. It's colorblind, it's an ultrasound, and it doesn't cause inflammation, so you're not going to get post-inflammatory inflammation in the skin. Okay. How long after a CO2 treatment can you do a Sofwave? So if you've done a CO2 recently, you'll want to wait at least 1 month. I would recommend you probably be better off waiting about 2 to 3 months. If somebody is, really hot on trying to prepare for an event or some sort of special something in their life, a wedding or whatever, then sometimes, yeah, we will push the envelope on some things as long as it's safe. But you'll probably want to spread it out a little bit longer than a month. What else here? Can airwaves and filler be done at the same time? I think she might mean Sofwave as well, and I already answered that. You can do them in the same visit, yes, but filler would always come second. The yearly retreatment, are as many pulses needed as the first time? I do recommend that you do the same amount of pulses every year. I think that, none of these treatments are actually making everything perfect. Okay, they're not surgery, and invariably people want more improvement, and so doing a treatment every year is just going to do that for you. So you may not go completely back to baseline in a year, but you're going to want treatment probably. It definitely depends on the person, and there are some people who are trying to cost analyze what's going to work for their budget, and that's okay. And if it means that, okay, I can only come in and do half the number of pulses this year, or I have to wait 2 years between treatments, that's fine. That's what you have to do. You do these things as your budget allows. So we are getting to that time. I am going to read a couple things here. Oh yes, after tonight's event, remember that you will receive a text message. When you get that text message, if you reply with the word lift, then we will contact you for a consultation and schedule you a consultation. You'll be able to have somebody give you an estimated number of pulses for your area that you're most concerned about, and also, help you decide, is the Sofwave the appropriate choice for you for your concerns. There might be something else that might be more beneficial for you, or a combination of things that might be more beneficial. Let me see if I can find a couple more. There's so many questions I'm kind of sifting through to see if some of them are duplicates. A better choice for the neck right now because of the season versus CO2. Okay, so this does not make you sensitive to the sun, and it can be done on tan skin. So you can absolutely do this right through the middle of the summer. Sofwave does not slow down in the summertime, versus a CO2, which this is CO2 season. People are doing it left and right. I do several a day now, just because the CO2, you feel like you're frying in the sun for about a month afterwards. So you want to be careful to do it when you're not going to be in a lot of sun. And here in Maine, we only have a certain amount of days of sun, so we want to take advantage of that and not have to hide. So definitely this is CO2 season. But does that mean you have to wait on Sofwave? No. Obviously you can do it at any time. It doesn't really have a season. What else? Do I have any more non-duplicate questions? So charge per area. How is the area broken up? Okay. Is this something that could be used for other areas like thighs or butt? So yeah, the Sofwave can be used on all parts of the body. The problem with it is that the number of pulses that it requires in an area, to get results in that area, it's a 2x2 square. So when you're doing body parts, that can be a lot of money to cover the whole body part. So can it be done? Yeah, absolutely, no problem. It's just about the amount of cost. There are new handpieces that are coming out that are bigger, and we're hoping that that's going to be more cost effective for people. So stay tuned on that, but you can definitely do it. I've got plenty of people who are opting to do, the inner part of the arm, getting that crepey skin on the inside of the arm, the little bit above the belly button where that gets really crepey and saggy after pregnancy. It's definitely doable in the whole body. What else? Are the Sofwave and or CO2 lasers okay with the pacemaker? Yes, the Sofwave is and the CO2 is. There are devices that are not, and they're generally radio frequency devices like the Virtue RF, scopes, things like that. You can't do if you have a pacemaker. Do you do before and after pictures? Yes. And so in the video that we did before the question and answers, there were several, but we also have several when you come in for our consultation, our free consultation. We can go over those before and after so you can see them. We have something called the TouchMD educational portal that we send people a link to, and in that portal has all of the things that we do, just like our website does, but it also has more before and after pictures. It has pricing, it has aftercare instructions and consultation points. So when you come in for your consult, you'll get a link sent to your email for that. And if you're interested, when they schedule your consultation and you want to look at it ahead of time, you can have them send you a link when they text you as well. So that's an option. Does CO2 get rid of broken blood vessels and rosacea spots? It does not. CO2 treats texture and pigment, but it generally doesn't hit the blood vessels. And I say that with a grain of salt because it's basically, I've seen it improve it, but I don't tell people to use that laser for that purpose. And that's the same goes for something like Virtue. I've seen plenty of people have improvement in redness and some veins afterwards, but it's not meant for that. If your primary concern is broken blood vessels and rosacea, then you're going to want to come in for a V-beam treatment, which is the vascular laser that we use for the red birthmarks people have on their face, for rosacea, spider veins around the nose, cherry angiomas on the body, all sorts of things. So definitely we have to decide what's the most important thing for you, and then we'll help you figure out what's going to be the best choice for that. Okay, looks like mostly same kind of questions at this point. So if we haven't answered your questions, these questions are all logged and I will see them afterwards. And if there's any on there that we haven't answered, we will get back to you and answer them, and we'll also be able to answer them during your consultation. So I do want to remind everybody that we have the 20% off till the end of March if you book for everybody. And after the event, all of you that stayed will be entered into the raffle for a free Sofwave treatment, and that will be a full face and neck. So you'll get to do quite a bit with that treatment. The chat, or excuse me, the text that you get, remember to respond to that. And I guess that's it. I appreciate everybody for coming. It was always a lot of fun answering questions, and I love that there's so many people who are interested in the device. So thank you and have a great evening, and I hope to see you soon. Bye.